Hello everyone, I'm Dr. Francisco. I'm live in Facebook once more in this group, Kidney Education and Kidney Disease Awareness. This group is destined to help patients with kidney problems, their relatives, their caregivers to understand a little bit more about kidney disease so they can manage it in a better way. If they manage it in a better way, definitely they can have less complications, potentially less disabilities, and less worries, and also less expenses. We're going to discuss how to prevent urinary stones. Remember, all this is sponsored by Francisco Kidney Medical Center. It's a new shirt. So let's start. For the prevention of new stones, the formation of new stones basically, or their growth if they are small and to prevent that they continue growing, it's crucial to implement the necessary diet, fluid, and lifestyle changes. This is because certain diets, for example, rich in sodium, low in potassium, low in calcium, contrary to what most people think, high in oxalate, low in citrate, high in uric acid, rich in sugars and simple carbohydrates, or high in animal proteins have been associated with higher risks of stone formation. Similarly, drinking not enough water, being slightly dehydrated, having a sedentary lifestyle, consuming frequently sugary carbonated drinks, or taking some supplements like calcium supplements or vitamin C supplements can favor stone formation in predisposed patients. Saying all that in other words, and the other way around, to prevent stone formation, a diet low in sodium or salt, sufficient in potassium, sufficient in calcium, low in oxalate, high in citrate, low in uric acid, low in sugars and simple carbohydrates, avoiding excess of animal proteins, and with plenty of fluids, not necessarily an excess of fluids, but at least 2.5 liters per day, can help in preventing stone formation. In addition, the moderation or avoidance, especially if not medically needed, of calcium or vitamin C supplements helps. A clinical dietitian would be the best person to advise on how to translate those recommendations to your daily meals. But I always give some tips to my patients, and if I, for example, detect some oxalate stones, I tell them what are the food that contains or is rich in oxalate, etc. Especially when they're not keen to see a dietitian. But I always tell them that they should reconsider that, because if there is an issue, especially if it is significant, it is better to sort it as effective, as targeted as possible with whatever help we can provide. In addition to all that, it is also necessary to exclude and treat adequately any metabolic problems that patients might have, like metabolic syndrome, gout, diabetes mellitus, or excessive weight, which predispose to stone formation. So treating all those conditions can help as well. Some patients might have rare diseases which are associated with stone formation, and only after a thorough clinical assessment they can be detected, and then some preventive measures implemented. Finally, some patients might have anatomical problems in the kidneys or the urinary tubes, and they can develop frequent urine infections, which also predispose to stone formation. So detecting these urine infections opportunely and treating them effectively can help too. As commented on a previous video, co-manage with a urologist is the way to provide more rounded advice. And for a more impactful prevention, seeing a dietitian does help. So I hope you found this information useful. If you have any comments, put it in the comment section. I will reply later. Remember, press like is my motivation to continue doing this, telling me that it works. I know it works because, in the background, many people don't press like or comment. but in the background they tell me that it has been helping them all this, and for all the feedback I had from my ebook. Remember, all this is also forming almost in real time. I do the script for this and we put it in the ebook. So if you don't like these videos or you don't catch my accent straight away, you can just always go and read it in my ebook. If you prefer or you like YouTube, you can see this video later in YouTube as well. And if you want a more rounded advice, help specialist, you can contact me if you want. So the other thing, just small break for an announcement. A couple of days I published a new ebook, the second edition of an ebook on diet for weight loss, telling what actually works and is healthy and what probably we should be doing if we want to lose weight, and also demystifying some of the myths of weight loss, and trying to channel people to go to the right way and not to fall prey of some methods that might not be effective, might not be or effective for sustainable weight loss, or might be a scam, or might be dangerous even, etc. And remember, if you are here because you want to take care of your kidney, if you have excessive weight, actually one of the ways to protect your kidney is by getting rid of that weight, because you will offload your kidney of extra body size to clean, so it's less work for the kidneys. And excessive weight actually has been associated with also kidney problems. It's a cause of kidney problems, scarring of the filters of the kidney. Plus, contributes to poor metabolic control, the development of diabetes, etc., that eventually will damage the kidney as well, or higher blood pressure, etc. So if you have, unfortunately, kidney problems and you have also excessive weight, you might as well probably read this book as well, and or put more extra efforts on that. The solution at the end of the day is just better diet, more active lifestyle, basically. Yeah. All right. It's all I want to say. So I'm Dr. Francisco, wishing you the best possible health. Take care, guys. Bye-bye.